One of the reasons why I wrote the second edition of this book, which has just come out, is that the framework of stress and trauma-related syndromes is the framework of diagnoses that we know the most about in terms of what causes it and what changes over time. So that in the treatment of stress response syndromes, we often go through stages of the treatment, and this book covers those stages more or less in the sequence of its chapters. And I focus on clinicians, whether they are psychologists or psychiatrists or other kinds of counselors, in terms of the decisions they have to make about the individual patient and the present moment of that patient in their situational context. So that very often we begin with support, but we eventually go on to aiding the person in processing emotions, exploring meanings, and even modifying their sense of identity and their capacities for relationships. So that the book goes from initial stabilization of mental states to techniques for aiding the person in what we might see as personality growth, because people can become stronger after they've recovered from bereavements and traumas. I take a transdiagnostic and integrative theoretical approach. My background, of course, is as a psychoanalyst and a psychiatrist and a teacher professing for many decades at the University of California. But I've learned from my colleagues that we need to cover different modalities of techniques, and that often goes also through stages of therapy. That's why in this book, I also try and teach a system of formulation and the idea that we have to reformulate a given patient in order to individualize their treatment over time as they go through the stages. So I've attempted to keep it a short book, but to have enough complexity that the ambiguities that often face us as clinicians can gradually be solved as we try and understand what's going on and what's possible. I hope you get a chance to read it.